Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
We met about full body scans and how they can cost as much as $2,000 to $3,000, and there's a lot of controversy about whether they're worth the money or not. And this particular article in the Washington Post talked about the fact that the wealthy are getting it, but the poor are not. And it talked about one case in which this person had a total body scan for $2,500, and they missed the fact that he had a coronary cerebral artery stenosis, which led to a massive stroke a couple of months later. And so they actually sued the company because when they went back and looked at the MRI, they did find that there was a stenosis of the vessel that they missed. So it caused a lot of concern about whether or not this is really approved. And the sum of the article is that MRI for specific indications is well known and acknowledged as the state of the art. But the whole body scan has not yet been demonstrated to be what is desirable. Although, because it's available and people say if you can afford it, get it, people do it. But there's a lot of pros and cons about whether or not it's something that you should do. Most people, there haven't been studies that have absolutely confirmed the value of it, although there's great studies that demonstrate if you have a specific ailment that MRI to identify a specific aspect of your body is desirable. But whether or not to get a full body scan still has not endured the test of time. But it's a subject I thought would be interesting for us to discuss because I don't know how many of us actually have decided to put aside two to $3,000 for a full body scan. Any comment from any of you relative to whether or not you have had or would want to have a full body scan?
I have a thought on that, Dr. Callender, because two things. I've heard where people have stopped smoking many years ago, and then they had that full body scan and find out that they actually have a spot on their lung after many, many years. And the other thought is we've had plenty of articles about AI, the use of AI with those scans that pick up remnants of issues that the human eye misses.
So which one do you want me to tackle first?
Or let's talk about the AI first.
Oh, the AI, they don't use it. See, all places don't use AI. So some places they just use their physicians who read the scans. And certainly the best is if you have a combination of AI and the radiologist, then you would be less likely to miss it. And in this case, it was missed. The stenosis was there, but the radiologist missed it. So that having AI would have helped in this case, because AI would have picked it up. The other part of your question was
the smokers who have quit smoking for many, many years, and then they find something on the full body MRI that was missed over the many, many years, even though they may not have symptoms.
See, the recommendation is to get a lung scan, not a full body MRI. The full body MRI is different from the uh, lung scan, which you get for people who are smoking or not smoking, because lung cancer occurs in those who smoke and those who don't smoke. So, what is actually recommended for those is a relatively low dose lung CAT scan that will pick up a spot in the lung, so that would be the CAT scan of choice. Would be a low dose CAT scan of the lung for somebody who was a smoker or who wanted to be scanned for lung cancer, which would be different from a full body.
Probably a lot less expensive too, right?
Yeah, much less expensive. Darryl,
Thanks.
any other comments or questions about the full body scan? The next article that was of great interest was article on what to do if you got the flu. And they talked about the fact that antiviral drugs help if you get the medication within 48 hours of the first symptoms. After that, it's less important. Of course, I think the most important thing of all is to get the vaccination to prevent it. And many of the studies, we still haven't had the study in the United States, the studies in other areas that suggested that, even though it's not ideal, that there's a benefit to the vaccination, which would likely prevent hospitalizations and deaths. So that the vaccine is the number one treatment. But if you are exposed to the flu, or you have the flu within 48 hours, the antiviral treatments are very effective. And they recommend within 48 hours of having any symptoms to take the antivirals. But the best protection still remains the vaccination, although we know that the new CDC has not made flu vaccinations necessary for children, but children have died because of the flu. And so there's a lot of criticism about that aspect of it. Any comments about the flu? It's taken a heavy toll. A lot of people dying and being hospitalized because of this new version of the flu. Any comments about that particular article? The antiviral medication is available, and now with the COVID and the flu test that's both being available, you can take the test, get the results, and if you're positive, then you can get your doctor to give you a prescription for the anti-flu medications. Any comments about that? And then finally, the biggest article of all was related to the new dietary guidelines, which we'll discuss later. But they had interesting, for the first time, they actually finally recommend that Americans avoid potato chips, candy, sweetened beverages, breakfast cereals, and uh, processed foods made with grains, added sugars, artificial sweeteners, and for the first time they said avoid highly processed foods, emphasizing uh, plant protein sources rather than meat, but not eliminating meat. And they had an interesting question that I'll give you. and you may have different answers. Should you drink whole meat? Yes or no?
What was that question again?
Should you drink whole meat? Yes or no?
Should you drink
Whole milk? Yes or no?
milk?
I used to. I don't anymore.
I think no.
I
It's
say no. This is Sylvia.
No.
It is presuming you're lactose tolerant. Because if you're lactose intolerant, obviously you shouldn't be drinking milk. But their answer is because they're predominantly thinking of white people, is that whole milk is okay. But of course, if you're lactose intolerant, as many of people of color are, then the answers would be no for a different reason, because lactose intolerance is common among our population. So the answer was yes. Should you eat butter? Yes or no?
Yeah, it tastes good.
Yes.
No.
And
Yeah.
Yes.
their answer again is yes.
No. It's the extra fat.
Did they say that is not the reason why you should not eat butter? That used to be the reason, but they say that while olive oil is preferred, butter is also another option. Just should be used in moderation. Here's the next question. If you have a flour tortilla turkey wrap, is that good? Is that something you eat? Yes or no?
Or what?
Flour tortilla turkey wrap.
Tortilla.
Yeah, tortilla. No.
Yeah.
And the answer is no, because you want to have whole grains instead of the
Flour.
wrap. What about sugar-free Coke? Yes or no?
No.
Definitely not.
No, it doesn't taste good.
And the answer is no, because there's so many studies now that suggest that Diet Coke is not healthy. How about using sauerkraut? Yes or no?
Yeah.
Yeah. And
I don't like it.
Me
Yeah.
either.
whether you like it or not, the answer is yes,
Yes.
because it's fermented foods such as sauerkraut,
Oh,
good
kimchi.
for your good health.
Mhm.
Now, there's another one which you will find an interesting answer to. Cheeseburger with a whole wheat bun. Yes or no?
Oh, Corey. Yeah.
Sounds
No.
good.
Yeah.
Oh, yeah.
Oh, it's got ketchup on it.
Yeah. Mhm.
Extra cheese for me.
The only reason they say yes is a whole wheat bun. And this is one of the articles that does not say to avoid completely red meat. It says you should have red meat if you're going to have it no more than once a week. But it says yes, cheeseburger with a whole wheat bun is something you could eat. And it recommends that there's other things it points out that for the first time, again, they're avoiding potato chips and candy and sweetened beverages. And that is now part of the U.S. dietary guidelines. So, haven't had. So, any comments on this? The fact that they still say that you can eat some red meat is interesting, although they recommend eating more plant proteins. Any other comments about this very interesting article which we were talking about again? We have an article on the new U.S. dietary guidelines.
Who was that was making all those recommendations?
Who's making all these recommendations? This is all from
Washington Post.
This is all from the U.S. dietary guidelines. Government released this. This is all from the government, U.S. dietary guidelines.
Mm.
Is that from HHS?
What's that?
Is that from HHS?
Oh, it said the U.S. dietary guidelines. I don't know.
Mhm.
Let's see if we have anything else specific. I know it. I think it's. I just know it says U.S. dietary guidelines. Doesn't say. Yes. Yeah, that's all it says. U.S. dietary guidelines. Federal officials released new dietary guidelines. So it's the government.
It's from the new guy.
DHHS.
Mhm.
What's that?
DHHS.
Yes.
Mhm.
Um, Dr. Callender, or somebody would know on this panel, if you think about cows and bulls, they eat grass all day and they get extremely large. It's like eating salad. Then you think about baby and why in this world, when you know a baby is born a mammal, they get the just milk and you grow extremely fast during those months on just milk. So why would you introduce that into an adult world if you don't want to grow as fast as big as a baby would grow? So how did us humans as adults start drinking milk as an infant? And why did we think salad would make us slim when it makes cows and bulls big?
I don't know the answer to your question. Why
Good question.
Mhm.
I don't know the answer.
Yeah.
Any other questions or comments?
Yeah. Okay. Yeah, milk is very calorie dense, and so it has a high amount of calories. There's a lot of enzymes and hormones in cow's milk that's designed for a 2,000-pound cow, not for a human being. Yeah, so it's a mismatch when you're talking about cow milk, but not the same thing when you're talking about green vegetables like lettuce and grass. That is not calorie dense, and that would not create a huge human being from eating green plants. Now, one of your assumptions, yes, naturally, cows, chickens, they eat grass. Um, but that's not the cows and chickens that you're getting. They're being fed corn, and corn makes them sick. It's not part of their natural diet. And so when beef cattle get sick, they load them up with antibiotics. They also feed them growth hormones. That's what you're getting in your beef, in addition to the calorie-rich content of the milk. So the antibiotics, the growth hormones, that's in the milk. That's in conventional milk.
Any other comments or questions? If not, I guess we can go to the articles. This is one of the funniest articles of them all. Dry January, which is something that came as a fad, in which you don't drink alcohol for the month of January. You start off the year with a vow to not drink for a month. And can you fix your liver in a month? And what the answer is that it seems as though the answer is yes, because all of the studies that they did demonstrated that the liver studies all got better within a month. And as a consequence, many people stopped drinking altogether, and some decreased the amount that they drank. And just about all of the studies, the enzymes and the ultrasounds of the liver demonstrated that the liver was much better. And it tended to stay that way unless they started drinking again. But the bottom line was that the dry January that started on as a fad really turned out to be something that was very healthy for those people who were drinkers. Now, of course, there is another aspect of it that they mentioned in this article as well. And that is if you're an alcoholic and you drink every single day and you suddenly stop, uh, uh, that can cause a withdrawal symptom that can kill you. But outside of that, it does appear that the dry January phenomenon has been effective in decreasing the fibrosis as well as other aspects of the liver functioning. And so this is a positive aspect of those people who drink, who stop drinking for a month, appears to be beneficial and healthy. Any comment about that? I was surprised to read that it really made a difference. But then I've never done alcohol anyway. Any comments on this interesting article?
Dr. Callender, is it healthy just for that month and then it goes right back to normal when they start drinking again?
No, it says that it lasts, it endures, and that uh, even after they started drinking again, most of them still maintain a healthier liver as long as they didn't go back to the heavy drinking that they had before. That's what the long-term study showed, that it endured for more than just a month, which means that alcohol is a poison, and so the less you drink of it, the better off you are, the better off your liver is. Any other comments or questions about the dry January phenomenon? Okay, well, let's go to the next article. This is very interesting to see that they increased payment rates for dialysis facilities, which means that it is likely that end-stage renal disease will be available for those who have kidney disease, which is in the top 10 of diseases that kills Americans, especially people of color. The people of color represent 2/3 of the people who are on the waiting list for kidney transplants. So this is important, and it's good to see that they are increasing payment. And I think this is a good thing that HHS is doing. We talk about some of the things that aren't so good that they're doing, but this, I think, is something that is desirable. In the last year, there's been not so many encouraging things about what HHS has been doing, but just positive. Any comments or questions about this? The positive nature.
Dr. Callender, does that increase affect the regular person who's going for dialysis?
It affects the dialysis unit only. So it affects the staff and the doctors, the healthcare providers. So it doesn't directly, but indirectly, the fact that they're paying for the treatment means that it's available to all who need it. This is the one place where universal health is actually applicable, because as long as you have kidney failure, and you can be insured for it. This makes end-stage renal disease the only universal health disease that we actually pay for. Unfortunately, it's not available for other diseases, but it is something that we've been doing since since 1984, I believe. So it's good to see that it continues. It's good for our folks. Any comments? If not, we'll go to the next article. It's nice to see that we got some positive pieces. Now, this is an interesting order that compares treatment of depression by psychotherapy and by exercise. And we've had many demonstrations that psychological therapy, especially face-to-face, is effective to depression. But now this article indicates that exercise is comparable to the psychotherapy that occurs. And so having a combination of exercise and psychotherapy is something that's desirable. But I think this is nice to know that the exercises you're doing is going to help depression and maybe minimize the need for antidepressant medications. So I think this is a good revelation that exercise, as we know, is good for most everything. Is also good for depression. And then lighter, moderate exercise is just as good as it's very, very vigorous exercise. So those of us who do the minimum of 15 to 30 minutes a day, 5 days a week, it's good treatment for your depression as well. And then here again, the combination of resistance training with the aerobic exercise is recommended, and that's true for in all instances. It seems that combination is very desirable. Any comments for depression, which is one of the comments that mental illnesses that we have?
Yeah. My comment is it may seem counterintuitive to exercise when you're either tired or you're feeling grumpy. But when you exercise, when you don't feel like it, you will feel better. Even 15 or 20 minutes will improve your mood, and you'll be less grumpy. And the people around you will appreciate it because you'll be easier to live with.
So true, so true, so true, so true. Yeah. Thank you for the time. Let's go to the next article then.
I think,
Yes, Dr. Burns.
and on that point, you know, the last several articles I think spoke to popular culture. You know, from the dry January to exercising to increasing the rate for dialysis. All of that becomes what we kind of expect, and we raise the expectation of our community and what we do. And I think it's a very important point. Just as I have become, just from this group, so sensitized to highly processed foods, to the small changes that I can make to make a difference. And I'm surprised that that difference then impacts my immediate circle. So anyway, I just wanted to point out, as we see all the catastrophes going on around us, how important it is that our mental health be straight, and how we can influence our neighbors by getting out there and walking, and instead of going for pastry, go for a walk.
Thank you.
It's changed the popular culture.
Thanks for sharing. Any other comments?
Yeah, I have a comment. When I'm in the car on the way to the pool where I do my swimming 3 times a week, I generally have a negative attitude. I do not want to drive a half hour to the swimming pool and do all this stuff, bring my bag and all this, and then check in. And when I'm leaving, I feel great. I mean, it's nothing, and I talked to a guy that was coming into the pool when I was leaving. He said it's the post swim high that you get. It's no, it's really a positive. It's amazing, and I've added some push-ups to my routine when I'm after I get out of the pool. When I get out of the pool, I do 20 push-ups. That also helps my affect. Thank you.
Thank you for sharing. Thank you for sharing. Any other comments? If not, go to the next article. I thought this was interesting. Getting the EEG is something that is something that is done in a similar way to which you do the electrocardiogram. But we now can get it done by just putting this in the ear canal, putting the invasive electrodes inside the ear canal. It doesn't say how the expense is, but it does say that this is something that is not had never been available before. Is now available, that allows you to get EEG just by putting the electrodes inside the ear canal. I don't know how it's going to work out, but it certainly is a new thing. Why do you want to do it differently? I don't know, but anyway, it's something that is now available that was never available before. And as we know, we are doing many more electroencephalograms to evaluate brain activity, to evaluate emotions, to evaluate the impacts of brain treatments, and to evaluate the effect of medication on different parts of the brain. And so this may make it easier to do so. Time will tell. This is just the first time it's available, so we'll have to wait and see. Any comments or any thoughts about the new EEG availability of it? Put these in
You know what my question is, right?
Yeah, they don't address how much it costs. That's the first thing I looked for, but they didn't say anything about the cost. That's an important question to ask. Okay, well, let's go to the next time. Let's see the next time. The fact that it could be used in little kids who might be harder to put some of those EEG wires on, make it easier for the children. This is an article talks about wearable technology in GI care. We talked about it in other areas. We talked about it in cardiology. We talked about it diabetes. But for GI care and the liver, we haven't really done much in the way of wearable technology for GI things like the liver and GI tract. And it's an interesting study that a third of Americans have wearable devices already, but they tell you about the heart rate, oxygenation, blood sugars, and other things. But none of them in the past have really been used to help with gastrointestinal and liver disease issues. With the GLP-1 drugs now and other things, it becomes possible that with the availability of ultrasonic studies of the liver looking for fibrosis and other ways in which the liver is abnormal, and looking at blood tests that enzymes, it could be conceivable that you could have wearable technology that could evaluate that. This is a few other areas, but we haven't really delved into that area. But that's an area that I think is fair game, and so it's going to be interesting to see down the road how this wearable technology that is involving all other fields is going to involve the GI tract as well. So we haven't really had examples of how this be done, but recognizing that there are signs of hepatic encephalopathy with ammonia levels and other things like that. We just need to identify wearable technologies that would allow us to look at the enzymes of the liver as well as the texture of the liver. Any comment or questions about this potential way of applying wearable technology to the GI tract? The liver, of course, the biggest cell in our intestines. So in the future, we'll see how far we can go with this in terms of benefiting the GI tract. Any comments or questions about this?
Yes. What is this dysphagia?
What is what?
Dysphagia.
Oh, it's difficulty swallowing. When you have difficulty swallowing, that's called dysphagia.
Thank you.
Any other questions? If not, let's go to the next article. So here's some more good news. So, we've given HHS such a hard time. And so let's deal with the good news. It cut and then reinstated about $2 billion in addiction mental health grants. And I'm happy this occurred because it seemed as though all of the things that HHS was doing was bad. So now we have some good things and good news to report because substance abuse and addiction research and improvement in those areas is very important. It made a difference, and so going backwards was really disturbing. So we are happy to share this good news. So, of course, this didn't just happen. It happened because people complained. And so we have to do as Dr. Perez has mentioned, we have to complain and protest. And as Darryl has said many times, that protesting is something that's been uniformly successful. So we can't keep quiet. We have to vote and as well as protest. Do both. both. And so it works. So at least we have forced the HSS to put back in place $2 million worth of research, which is good to hear. Any comments about the positive news about HSS?
Yes, Dr. Callender, I heard, I don't know, maybe somebody can verify that either Trump, I think Trump may have had like a family member, a sibling, or an offspring that was affected by substance abuse, and he was, willing to cooperate in this respect, and maybe even Robert Kennedy may have had a family member affected by. But there are not too many families across the country that are not affected.
Yeah, find one, you'd be surprised.
Yes.
I mean, it's something that affects everyone. Yeah. And, the more you think that it doesn't, the more it does. Yeah. So it's a good thing. It's nice to see HHS doing responding to criticism. So all the news is not bad. It's good news. So let's give them credit. Yeah. Any other comments? To go to the next article. Rejoice, however. Now, this is an article that is interesting in that it says if you get kidney stones, there's linked to cancer increased, and it suggests that this is particularly true among women. But it's not a huge association, but it is an association nonetheless. So what they're suggesting is that if you have a kidney stone, that you should make sure you get a kidney evaluation thereafter, because kidney cancer is slow, and sometimes it's slow growing cancer that you don't think of. And so if you have had a kidney stone, it's important to get a follow-up study of the kidney uh, ultrasound or something else to show presence or absence of developing kidney disease, kidney tumors, because kidney cancer is lethal if it's not diagnosed early enough and removed early enough. So, so this is another warning sign that if you had a kidney stone down the line, make sure that they study you to make sure that you don't develop cancer in the kidney. This is the first report I've seen where kidney stones are associated with kidney cancer. Any other comments? If not,
I had a question, Doc. What what are kidney stones made of, and when they treat them, how do they get rid of them?
well, the kidney stones vary. They can be calcium and other substances. And the treatment is to either let them pass. If they don't pass, they have a way of either going to retrieve them surgically, or they have a way of radiologically dissolving them. So that there's a couple of treatments. Some are surgical and some are not surgical. But they have a new X-ray technique of softening stones so that you don't have to go in and surgically remove them. But the stones can be made of calcium, they can be made of phosphorus, they can be made of different elements, different, and so um, uh, for that reason, some were able to be dissolved by radiological means, and some require surgical removal. Because if they block the flow of urine, then that would cause hydronephrosis and other kidney problems.
Well, one of my friends had, well, two of my friends had kidney stones. Extremely painful, they told.
Yeah, the most painful condition other than pregnancy, kidney stones. That's it. Not pregnancy. Liver and drainage.
Dr. Callender, this is Sylvia. Good morning, everybody. So kidney stones, I mean, I've never had them, but for men, they pass through the penis, and for women, do they just pass through the penis in men? Do they come out any other way, or for women? How do they come out?
The tube that takes urine from the kidney to outside goes through the urethra in women and through the penile urethra in men. Um, and so if they pass, wonderful. But if they don't pass, then you have to either dissolve them, and they have techniques of dissolving them, or surgically removing them. Does that answer your question?
Yeah.
Okay.
Yeah.
Any other questions about the kidney stones? Yeah. This is an article that I thought we included. Do tattoos carry a hidden cancer risk? And it's the inks that are the problem, and the pigments that are in the dyes that are the issues. And they're suggesting that there isn't a huge carcinogen link, but there is a link. And this is a Danish study. So I don't know about in the United States if we have done studies to identify the effect of the different uh, pigments that are used for tattoos. But it's clear that it can be carcinogenic. I don't know that there's a lot of evidence one way or the other, but it's something that is so common these days that with time we should do more incidents to whether the dyes we're using in these tattoos have a short or long term risk of lymphoma or other cancer. But there's not a lot of data yet. And so we're kind of going to have to wait and see the additional studies. Yeah, this is a Danish study. We don't have an American study that's equivalent. The time will tell. Most of our kids are getting tattoos, so the long-term effects will be.
Darryl's hand is raised, doctor.
Yeah, Darryl, go ahead.
Yeah, going back to kidney stones, excruciating pain. Men complain about it more than women. Women say that it's worse than childbirth. But the men's complaints, when they say it's the worst pain ever experienced, that may be just because men complain more.
I don't think so. I think it's because it hurts. I think it hurts. So, Dennis?
Yes, I've never had kidney stones. My sister had it. I was there. I didn't know what to do. We called 911 and she was in extreme pain. And she did say it was worse than childbirth. And then she passed it. They kept her in the hospital. She passed it. Several months later, not quite a year, they said if you have it once, there's a chance it'll happen again. And it did for her. But they did it laparoscopically. It didn't cut her. She was in and out in a couple of hours. I don't know exactly what that meant, but it wasn't major surgery. And she's been doing fine ever since. So I don't know if there's a chance that it could happen again, but the first time they told her it could possibly happen again. But laparoscopically, she said it was so much easier than passing.
Any other comments? Thank you for sharing, Jerry.
Yeah.
I have a comment, Doc, for blood donation. Tattoos will eliminate you from being a blood donor.
So you cannot donate if you have tattoo?
Correct.
Mhm.
Okay, thank you for sharing that.
Can't donate if you're what, Darryl? I mean, John.
Blood don't if you have tattoos.
Oh, tattoos. Okay.
Mhm.
Okay, let's go to the next one. This is a study that will surprise no one, that the cancer risk is related to what's in your food. And sometimes we're unaware of the fact that the processing of the food puts substances in the food that allow the food to exist for a long period of time. As you see, you have potassium sorbate, sodium nitrate, and potassium nitrate. These are present to allow the food to stay around more, but they also increase the likelihood of different kinds of cancer. These preservatives mean well, they're meant well, but the fact is that they are associated with increased risk of overall cancer as well as breast cancer and prostate. So and that's the issue that actually Darryl has talked about incessantly. That often people meant well with these preservatives and these other antibiotics and other things, but they also uh, cause bad things to happen, including being carcinogenic. And some of these preservatives are in wine, beer, dried fruit, uh, cheese, and condiments. And so, wherever you have things that are meant to make food taste better or keep them fresh longer, these preservatives or whatever you want to call them have a propensity to be carcinogenic or cause other problems. And so it's not necessarily sometimes what the foods or elements that are, but the preservatives and other aspects of the making the food more desirable that works against our health. And so we need to know not only what the food is, but what is in the food to make it taste better, to make it last longer. And these preservatives sometimes are the enemy rather than friends. Any comments, Darryl, or anybody else want to comment on these things that make our food that we eat dangerous to our health? Darryl?
Yeah, my comment is that with dried fruits, is usually the stuff that they add to it, the preservatives, not necessarily the dried food itself, but um, all the chemical word soup that you read on the label. That's what caused the dry fruit to go bad and become carcinogenic.
Thank you, Attorney Buchanan. You had a comment?
Actually, no, I left my hand up, but I do have a welcome to a new member of our group, Mr. Ali Robinson. I want to welcome him and encourage him to keep coming.
Well, thank you for joining us. We're thrilled to have you with us and hope you can get back.
Thank you, and thank you, John. And hello to everybody here today.
Hello to you and welcome. And we're thrilled and excited to have you join us. Okay, let's go to the next item from the Dallas comments that we want. Acupuncture massage programs immediately benefit underserved patients with cancer. Interesting. So, over the last 10 years, we've done many studies to identify many ways in which non-traditional services are beneficial to patients. Acupuncture is one of them, and many others, but massage services also have demonstrated that they help patients with cancer, whether they improve responses to pain, responses to nausea. They all decrease anxiety and fatigue, as well as decrease the pain, so that they are much more sensitive to and appreciative of many ways in which our patients can be benefited by conventional and not so conventional types of treatment. Many of the studies including yoga part and parcel of the non-traditional treatments that we have built in. Anybody have any experience with acupuncture in this group? But that's interesting because acupuncture and massage is not something that we traditionally recognize. But this article wants to change all that. So, good to share.
Dr. Callender, is the acupuncture part of the treatment for cancer now? Or is this something?
This is now. This is what they're doing now. Yes, they are recommending this as part of management of the anxiety and fatigue that goes along with cancer. So this article is saying yes, that there's a role for acupuncture and massaging of the treatment of cancer. That's what this article is.
Okay.
It doesn't say it replaces anything, but it does say that it is helpful in terms of addressing anxiety as well as fatigue. And I mentioned music therapy as well. And we know a lot about the role of music therapy in disease.
Yeah, Dr. Callender, I was thinking that not Hispanic speakers would gravitate more toward massage and acupuncture, but I would think, especially for acupuncture, that Asian people would gravitate more, since I thought acupuncture was an Asian modality, I guess. It's a good way to put it. What do you think about that?
Well, I was always had the same bias that you have, but I don't know that is anything other than a bias. I don't know when acupuncture first came into the medical arena, it was primarily introduced in the Asian population. But that doesn't mean it was exclusively there, but that's how we saw it. Dr. Perez?
Back in the day, um, the young lords, with support from the Black Panthers, took over Lincoln Hospital in New York City with the hope of making acupuncture available to the addiction, those that were suffering from addiction, and to have it supported by the healthcare system. So there was a definitely non-Asian population that gravitated to it. And I have seen its successful use dealing with addictive disease.
Thank you for sharing. Any other comments or questions? This very interesting paper. If you broaden our horizons. The next article.
My internet is a little slow, so it's coming.
Well, this is an article that seen before, and it talks about the association of long-term cardiovascular disease and high lipoprotein levels, particularly in women, and lipoprotein A levels. And this is I've seen several articles recently that talks about lipoprotein A as being something that should be part of the workup for women as they age. And it hasn't been as popular as I thought, but I've seen a number of studies recently that keep talking about LPA, lipoprotein A, particularly in women, as being the substance that needs to be looked at. And if it's high, it needs to be treated by lowering the cholesterol level. And so lipoprotein level in women also is another article we'll get to. It also talks about another cholesterol moiety in addition to lipoprotein A that should be looked at in adults over 45, particularly women. So the role of cholesterol it has not been thoroughly defined, so that getting special cholesterol levels is not the routine part of physical. And the cholesterol levels of the traditional ones, LDL and HDL, just two of them, but the additional one, LPA, is one that's associated with ischemic stroke and also coronary disease, other diseases. And so if the cholesterol levels are high, then cholesterol lowering medication may be a benefit. That's the purpose of it. And it's a high risk of cardiovascular morbidity and mortality if the LPA is high. The question is whether or not these should be part of your blood work that you get when you go through the annual physical. That's something that has not yet been agree with you. But many of the recent studies are suggesting that they be included in the screening process. Any questions or comments about the cholesterol level?
So, Dr. Callender, is that LPA normally tested for when you get your blood work done, or do you have to ask for that?
You have to ask for it. That's the problem. So it is not normal. You have to ask for it.
I'm still having a little trouble hearing your responses, Doc.
Oh, yeah, I said you have to ask for it. Yeah, it is traditionally not included in the annual blood testing. Unless you probably had a cardiologist, they would not routinely do an LPA. And these articles are pointing the way, but haven't yet made it so that it would be routinely part of the annual survey for all people who go to get an annual physical evaluation. Any other comments?
Darryl,
Well,
has
if I
his
understand,
hand.
yeah, if I understand this, it seems that LPAs are a part of the LDL cholesterol, but they don't respond to statins. And it seems like the recommended way to get LPA down is through lifestyle changes. If you're overweight, get to a healthier weight. If you smoke, quit. Doing those type of things, healthy diet and lifestyle.
Thanks for sharing. What is interesting is why it's associated with women rather than men. Now this is a study that actually looked at the four lifestyle medicines, four pillars, and of course something that we talked about through the session. Cardiorespiratory fitness, vitamins, that's cardiovascular mortality, cause mortality, and the importance of your diet, your exercise, your lifestyle, the pillars of the lifestyle. As more studies are identifying, actually food is medicine, and so physical activity, nutrition, sleep, and stress, all of that plays into your lifestyle. And yes, you are kind of what you eat, and you talk about the risk-based things you learn on risk, except the thing that is bothersome is that most of the people probably don't have these wearables. And of course, we talk all the time about colon cancer and colonoscopy, importance of exercise, importance of education, and of course, nobody would forget the cardiovascular health monitoring, except that it's not generally available to all. And They have done many studies adults who are over 65, 68, and they recognize that there's so many aspects of health that we need to pay attention to, all of which we talk about. And, there's no underappreciating the effect of what you eat, you exercise, your mental and physical and spiritual health as well. I think one of the most disturbing observations is that in spite of everything that we've done, we still have a significant increase in cardiovascular mortality, which suggests that we are doing something. Either not taking the medications correctly, not eating correctly, and not exercising enough, not using resistance with exercising. I think a lot of it also involves the pollution that's in the air as well as not only the pollution that's in the air, but the PFAs, the plastics, and there's other things that affect us. I think one of the important things, of course, was recognizing what smoking is doing, and I think it's the U.S. dietary observation about the recognition of the unhealthy food that we eat, all part of the healthier lifestyle that we need to adopt in order to live as long as we can. What is frightening is the number of people who die of hypertension and under the age of 60 and under the age of 3 and 10. And so why is it that longevity in the United States is incomparable to longevity in other countries? And so all of these 4 lifestyle changes play a major role, and that's what this article is addressing. The fact that the cardiovascular mortality is still increasing, and it suggests that we're not paying strict attention to all the aspects of our health, and as a consequence, we're not living as long as we should. And since we talk about 10, and we have so many people dying under 70, so we need to address all of those aspects of it. And as you see here, the social aspects of it are as important as the other aspects. We talk about the other lifestyle changes. Sometimes we don't emphasize the negative aspects of social isolation. And this article looks at every one of those aspects. Any comments about this article, which is addressing the aspects of healthy living and healthy lifestyles that we talk about on this program just about every week.
Dr. Callender.
Yes.
I don't know whether I'm the only one, but your voice is muffled. When you lean in, we can hear you, but if you straighten up, then your sound, I can't understand. So I don't know whether that's for everybody.
It is. It's this computer. So you have to rely on it so I can get closer and speak up. Thank you. Yeah.
Well, I heard you say earlier you were on a different computer, so
probably.
maybe that's the problem.
I'm
Yeah.
trying to adjust it. So you have to keep me honest. So when you can hear me, let me know so I can get closer.
Yeah. So I think when you lean in, we can hear you better, but your voice is still kind of muffled.
Okay. All right. Well, I'll try to stay as close as possible when you
That's
can't
better.
let me know. Yeah.
Okay. That's better. Thank you.
Yeah.
Yeah, a couple comments about diet and exercise. First, exercise. Um, they say if you have problems getting into an exercise routine, it's better to do it in the morning because at least you get it out of the way. The more you wait, the longer it goes in the day, the more you're likely you are to procrastinate. But if you are in a good exercise routine, they say your peak physical activity is your peak body performance is going to be from 2 to 6 p.m. because you're warmed up by then. You've got the best body temperature to be more effective with exercise. Uh, Night exercise is usually not a good thing. Uh, okay, as far as diet, people ask me a lot, what do I eat? You know, we're into an entree culture. We got to have 3 or 4 things on the plate to consider it a meal, unless it's hamburger and fries. You know, then we're good with those two. But you know, back in the old days, people ate out of a pot. They threw a bunch of stuff in there, whether they called it porridge or stew or whatever. But you know, you varied it so that you weren't getting bored all the time. And there's you know, in our day and age, you can easily steam a meal very quickly. You know, you can steam a meal just depending on what it is in 15 or 20 minutes, and then you're ready to go. So you can throw a bunch of vegetables in there. You know, it could be carrots, collards, kale, sweet potatoes, peas, green beans, just all of the list of fresh produce, and you just throw it in a pot and steam it, and you know you vary it so it's not the same all the time, but it's a very easy meal. You could have over wild rice, and now you're not doing an entree with you know, a standard American meal with 3 or 4 things on the plate. You're just eating out of a bowl, and if it's you're not as likely to overeat if it's out of a bowl, but you got all kind of flavor and texture. You can season it. You know, so eating healthy can be very quick. It can be very easy.
Any other comments about eating and, of course, the exercise and the meditation we tend not to talk too much about, but it's as important as the other things, as well as the screening processes that can't be underestimated, as well as the vaccination processes. And then, of course, as we mention all the time, the association of resistance exercising along with the aerobic exercises. I think then, of course, you cannot underestimate the importance of if you are on medication, to take the medication. Because if you're hypertensive and you're not taking the blood pressure medication, that may be the reason why you have still increasing cardiovascular mortality. So, and as I mentioned, the fact that we have so many people who are dying under 70 is a sign that lifestyles are not adequate. Any other comments about the ways to adopt a healthy lifestyle? Eating is a part of it, exercise is part of it. Taking medication is with whatever disease entity you find, whether you're diabetic or not diabetic or obese. You know, you drink alcohol, don't drink alcohol, smoke, don't smoke. All of those things contribute to it. And I think the one thing we tend not to talk too much about is the social isolation, because we talk about that as well every week. But diet, nutrition, exercise, meditation, all of them go into the whole 4 pillars of what we call healthy lifestyle. Any other comments about it? Because this is an important aspect of all of our lives. It's an interesting group we have because there are many of our group who are 70 and older. So we got to 3 score and 10 for many of us. Any comments on this? Because I think this is probably as important as any other article that we talk about. And what is disturbing is that, in spite of all this, we still have an increase in cardiovascular mortality and morbidity. Any comments or thoughts about how we do better? No comments? Okay, let's go to the next article. This will probably be the last one. I have to leave at 10:30. This is an article that talks about poor asthma control is associated with greater dementia risk, especially if you're in the middle age. Asthma is a condition that is very common among our ethnic group, and having poor asthma control results in early mortality and morbidity. Up until now, it hadn't been associated with increased dementia, but now this study is identifying a association with increased dementia. You really need any more negative factors, but dementia is something that we recognize as something that's common in women and people of color. And so having good care of whatever diseases we have is an important way of increasing lifespan. But we just have not made the association of asthma and dementia, which this article is identifying. It's interesting because my family's had a lot of asthma, but they've had a number of younger deaths from asthma, and not the dementia. I don't know about you. Have you had any association of asthma control and dementia? I haven't seen an experience, but this is first article to identify this association with asthma and dementia. And whether this will hold up over time remains to be seen. This one of the first studies is suggesting a link between asthma and dementia. No comments. If not, let's try one more article and then call it a day. Oh, this is an interesting article that talks about the fact that now if you have a urinary tract infection, the urine dipstick is not recommended according to this article. And that if you have a urinary tract infection, with a urine culture should be done to decide whether or not antibiotics should be used. And dipstick, according to the French Congress, is not recommended any longer. Of course, this is not necessarily demonstrated in the English United States, but the reliance on urine cultures rather than the urinalysis is something that we feel is recommended in the long run, particularly in males, because there's a concern that there's the inappropriate use of antibiotics for urinary tract infection when the cultures are not done. So this is getting away from the urinalysis, and if you have a urinary tract problem, they can get urine cultures should be obtained before starting any antibiotics. I think that's the essence of this particular article. If you have symptoms, burning, dysuria, which means pain from urination, abdominal pain, or hematuria, then still you should get a urine function. It's positive, then you should get an injury. And that's the essence of this article. Okay, this is the last article, so let me close with this one. I think we all had the opportunity to participate in John Tatum's memorial service. It was a great service. And any comments about the service before we talk?
The music was outstanding.
Yeah, sure was.
Truly represented John. The music was just John and Carol for that matter, but the music was just outstanding. And Sylvia, I heard you clearly.
Absolutely.
Oh no, really?
Yeah.
Yeah. Yes.
What?
Yes.
I don't know if that's good.
Yes, it was
It was
very
beautiful.
good. It was
Oh,
very good.
okay.
Very good. Yeah. Yeah.
It's a wonderful service.
Beautiful service. Yeah.
It was.
hmm And the food. Thank you, Carol.
Okay, and so we pray for Carol as she said, moment by moment.
Yeah.
Yeah,
And,
Carol's
and go ahead.
meeting with the mortician right now. That's why you don't see her.
See her. Okay. And for those of you all who weren't there Thursday night, that was also a lovely service, just representing all of what John has done in the community, and songs and talks, and it was real. We got to know him better. I learned a couple of things I didn't know. So it
I
was,
wasn't there Thursday, but Friday,
yeah,
I heard so many people speak about it. They said it was absolutely
yeah,
beautiful.
it was.
Yeah.
It was. I left early, so because I was riding with someone else, but what I heard, the 2 hours that I was there,
Mm.
it was outstanding. John, I don't know whether you stayed till the end.
I did.
Yeah, you stayed till the end. I asked Carol when I got to the funeral Friday how late, what time she got home. She said she didn't get home till midnight.
Oh my
I
goodness.
said I couldn't believe it.
Okay.
But
I've
it,
got that meeting, so
okay.
The remarkable thing about John is that he accomplished an awful lot and
Awful
during his
lot.
life, and more than most people knew, but he never bragged about it.
Sure
Yeah.
did.
Very
Okay.
humble guy.
Yeah. That's that family. As I said Thursday night, I've known the family through 4 generations, starting with John's grandfather. And they were just like that. Just, they did what they did, and,
Mhm.
you know, yeah.
Beautiful.
Yes,
sweet.
very humble family.
Very full. Yeah. Yeah. Going to be missed. He's going to be missed
Mhm.
by a lot of people. Yeah.
All right, everybody, have a blessed day.
Yes, yes.
All
Oh,
right.
we've got
Thank
a
you.
we got a new got somebody new that joined the group, Kathy
Yes.
Fox, Kathy Cunningham, longtime friend of Carol. And I don't know, would you like to say something, Kathy?
I was on last week, Darryl. You were not there. So this is my
okay.
second time.
All right,
But
thank
I've
you.
enjoyed it. And I understand the comments about the cholesterol, because that's one of the things that I have to be careful of, because I've had a triple bypass. So I have problems with my cholesterol. So that was very good information.
Good.
Well, it's like Dr. Callender had to go.
Yeah.
Yes.
Darryl, it was good to see you too, Friday. Good to see you.
Thank you.
Yeah.
I will see
I see you got back home okay.
Yes, I did.
Yeah.
Prayers continue to be with the whole family.
Whole family.
Absolutely. They're
Yeah.
wonderful, wonderful people.
Yes.
Take care, everyone.
Yeah.
Bye-bye.
Bye-bye.
Okay. Bye-bye.
Good week.
Yeah.